Hey friends, this is Dr. Steve Hruby, and I am the head doctor here at Kaizen Progressive Health, head chiropractor. So I am a chiropractor, licensed physiotherapy. We are an integrated medical clinic here. So not only do we do things on the chiropractic PT side, but we do things on the holistic medical side as well too. I'm doing this video today to talk to you a little bit about headaches and migraines. One of the things that we see so often and we get some of the best results with is people who suffer with headaches and migraines. And it is actually shocking to me, practicing for 22 years, how many people are really suffering out there. And you might be one of these people, or I'm sure you know somebody who suffers with headaches and migraines. And most of these people actually haven't tried anything other than drugs and medication. And at best, if drugs and medications are helping you for headaches and migraines, they are a temporary fix. They're maybe helping you in the moment with the headaches and migraines, but they're not really doing anything to fix the underlying cause. And that's where, more often than not, we're going to be able to help you. I am often called the neck whisperer because I get such good results with headache and migraines. And why am I called the neck whisperer, and how does that tie into headaches and migraines? Well, almost all headaches and migraines have an association and a contributing factor related to your neck muscles, the suboccipitals. Those are the neck muscles between your skull and your neck. Often headaches and migraines are also going to tie into problems with your upper back, as well as problems associated with your shoulder. And one of the biggest things that can be a contributing factor in causing headaches are actually jaw issues. So if you're suffering with headache and migraines, one of the first things we're going to do when you come in here is we're going to assess all of that and see what your contributing factors are. And how are we going to assess these, and what separates us from most offices is the technology that we have. We have digital x-ray, which you can see right here. So we're going to take x-rays, see structurally what's going on and what may be contributing with headaches and migraines. There can be decay and degeneration. There can be old traumas that are contributing and causing these headaches and migraines that you're having as well. We're also going to do a test called an SEMG, surface electromyogram. That test is pretty much going to tell us if you're in the right place to get help or not. That test, it's a non-invasive test, is going to directly measure the electrical impulse coming from your brain, down your spinal cord, out your nerves, and we're going to look at specifically the nerves that regulate brain sensation. So if you got interference there, that is a contributing factor with headaches and migraines. Now, another thing that you need to look at, and you're probably already aware of if you suffer with headaches and migraines, are what are the triggering factors for you. And triggers are always going to be related to stresses in your life. Now, simple like stress, like I'm stressed out with life, work, relationships, finances, can certainly be a trigger to these types of things. But there also can be food sensitivities that you have. You can be having problems with your sleep regulation. That can be causing headaches. There are also allergies that can cause and contribute to headaches. There can be recent dental work that you have, or dental work that you've had in the past, that are causing and contributing. So we are looking at all these things. So everybody's a little different in their presentation of why they're having headaches and why they're suffering with them. But they are really, for so many people, debilitating, especially if you suffer with migraines. And if you suffer with migraines, you know it's more than just the headaches. It can be affecting all aspects of your life. Migraines often are associated with auras. So that can cause extreme sensitivities to light, to sound. Many people suffer with migraines. Their simple solution when they get a migraine is to lock themselves in a dark room. We have such a good track record with almost everybody who suffers with headaches and migraines of reducing severity and reducing frequency. So if you're suffering with headaches and migraines, please, please, please get assessed. There is very likely solutions to your problem that you have not looked at. Now, another thing that's often going on with headaches is the brainstem is often getting affected. Now, you don't feel your brainstem. So nobody's ever said to me, Dr. Steve, my brainstem hurts today, right? But here's what we know through science: mood regulation, sleep regulation, concentration, focus, energy levels. All those things, when your brainstem is being affected, are very likely being affected as well. In fact, a lot of people are suffering from those things and they're not even getting the headaches and migraines yet. Often the headaches and migraines, the painful part of those, are the last thing to show up. So often you're feeling these other things that are affecting your life way before you start suffering with the headache themselves. So invite you to come into our office. I really invite you, if you're watching this video and you've gotten this far, look at our reviews. You're going to see a lot of reviews where people talk about the results that they've gotten specifically with headaches and migraines. And here's one more thing. If you've never been to a chiropractor before, you might be scared of the popping or cracking, or maybe you have been to a chiropractor and you had a bad experience. We have technology here that we don't ever have to pop and crack you. In fact, there's many people that we don't want to pop or crack. They might have too much damage that's occurred over the years to their neck. So in those situations, we have specific technology. We have one technology called the Pro Adjuster. It utilizes technology that NASA developed that vibrates motion into your spine rather than twisting and popping and cracking. And we do that as well. So whatever's going to get you the best results and whatever you're comfortable with is what we're going to want to utilize. One more thing that I have to mention, I have a lot to say about headaches and migraines, is we do have a holistic medical side. And often there are part of the solution to your headaches and migraines are things that we may want to look at on the medical side. Perhaps you have specific nutritional deficiencies that we can test via your blood work. You may have genetic reasons that you have problems absorbing those specific nutrients that you need. We can do vitamin mineral IVs. There's actually a whole slew of things that we can be looking at that are holistic, that are going to work naturally with your body to get you the results that you're looking for. So thank you for taking the time, and we look forward to seeing you here at Kaizen Progressive Health, located in North Scottsdale, right off the 101 and Frank Lloyd Wright. See you soon.